Good evening. Millions of Australians will catch COVID this winter. That's the stark warning from the Health Minister, with a new wave set to wreak havoc for at least the next month. Another 44,000 Australians were confirmed with the virus today, including more passengers and crew on a giant cruise ship which docked in Sydney this morning.
Arriving in the pre-dawn darkness, the Coral Princess, sister ship to the Ruby Princess, but any comparisons between the two completely dismissed by passengers today.
Don't worry, it's all clean. There's nothing happening on there. You guys are the media beat up.
Nobody's coughing, nobody's sneezing.
No.
There's nothing wrong with it.
Probably feel safer on board than off.
Owner Carnival Cruises reports 10 more cases overnight, to a total now of around 120. They're confident they've contained the spread.
This is the protocols working.
Passengers say they feel safe.
It's wonderful on the ship. There's no sickness on board.
The room is being cleaned, there's spray everywhere. We feel really safe.
Under Amber Alert status, there are extra safety protocols like mandatory rat screening before disembarkation.
Did anyone check your rats this morning?
No.
Carnival confirms it is an honesty system.
It really is the community standard self-administered and self-reported rat tests.
But as the Princess prepares to sail for Brisbane tonight, warnings a new COVID wave is about to crash across the country.
There are going to be millions of people infected by COVID in this coming few weeks period.
Hospital beds are filling up, with almost 5,000 COVID cases on wards tonight. Infections also increasing, 44,000 new cases in the last day alone. The total nationwide tonight, 300,000.
The real number's probably twice that, or maybe even more.
From the Queensland Premier,
I think it's going to get to the stage in the next 2 or 3 weeks we may have to have a National Cabinet meeting.
the new surge hitting just as the federal government switches off critical COVID support, like free rat kits.
Even welcome programs like this one have to end at some point.
The federal government is urging anybody who's eligible for the free rat kits to stockpile them now before the scheme ends at the end of the month, and they stress that there's still free testing centres operating in every state and territory. No safety net, though, for anyone forced off work without pay due to COVID, like casuals, those who've used up sick leave.
Given we've got $1 trillion in debt, we cannot continue to borrow money to fund emergency payments forever.
Already, the workforce has taken a massive hit. Data from payroll platform MYOB shows sick leave up 35% last month, as employers brace for worse this month and next.
And Chris Reeson joins me once again. Chris, does the return of a serious COVID wave mean the return of COVID restrictions?
Not at this stage, Mark. On masks, the New South Wales Health is recommending them, but there's no move to mandate. But on work from home measures, the Federal Health Minister, Mark Butler, said today he believes employers should review their existing arrangements and allow it where possible. It's only a voluntary option, not a government order, but it will be one that will infuriate employer groups. But one other note, important too, from next Tuesday, Qantas is lifting its requirement for international passengers to be vaccinated, but they're warning to check the entry requirements for your destination.
OK, Chris, thank you.
I'm Marguerite Fitzgerald, President of Carnival Australia. I've got a few words that I'd like to say. So Princess Cruises is one of the 8 cruise lines that Carnival Australia represents in the region. Carnival Australia is the largest cruise company in Australia. Yesterday, Coral Princess had a very successful first stop in Eden, where she was warmly welcomed by civic and business leaders who were very happy to see the return of cruising and the economic activity that it brings. Today, she is shaping up for another successful visit to Sydney as our guests get out and enjoy the CBD, the city, and support the rejuvenation of the CBD. It is also the first time a cruise ship has brought tourists to Sydney in over 2 years. I would like to acknowledge New South Wales Health and the support and the standing up for the protocols that they jointly developed with the cruise industry and the other eastern seaboard states. These protocols really have supported the resumption of cruising and the rekindling of the $5 billion a year cruising industry in Australia. These protocols were designed with the knowledge that Omicron cannot be stopped from any place where people congregate. They were designed to manage COVID on board a cruise ship. They were designed to ensure the safe operations of a cruise ship and the health and well-being of the guests, crew and communities that we visit. These protocols, that is why everybody, all the crew and guests are vaccinated. That is why anybody who shows COVID-like symptoms is tested, and our crew is also regularly tested. And that is why we have increased the medical resources on board the ships. More doctors, more nurses, and COVID medications. What else did I want to say? Now I've gone completely blank. I'm sorry.
Where do you go from here?
Where do we go from here?
Yeah.
Well, this ship goes up to Brisbane tomorrow.
So it leaves port in the morning?
She leaves port this evening, and she will go up to Brisbane and sail up to Brisbane.
Do we know roughly what time this evening?
She's leaving about 9 o'clock this evening.
And can you give us an update on the number of people on board who have been affected?
I believe now the numbers are similar to what they were yesterday, so about 110, 115 crew, and we've had more guests test positive today as they've exited the ship. And we believe, and the health authorities have also said, that most of those guests probably brought COVID with them onto the ship when they embarked in Brisbane.
And that's people who tested positive on a rapid antigen test before disembarking at Sydney?
Yes, that was part of the protocols that we worked through in collaboration with New South Wales Health. It's been a very collaborative relationship as we've worked through what are the protocols and how do they apply. I should say that these protocols, nothing here is new. These were all protocols that had been agreed in advance.
How many new guests? I'm assuming it's still majority crew?
Yes, it's predominantly crew.
So how many new guests roughly?
I think it's around about 10.
So does this indicate, Marguerite, that the protocols are working? We haven't seen rapid spread.
That is exactly it, Chris. This is the protocols working. It shows that we actually are able to very successfully operate crews in a COVID environment. This is the only industry where we have protocols at this level. They are higher protocols, and we do embrace them. They give us the confidence to operate in a COVID environment.
So those 10 guests who did test positive on exit, how were they then managed? Were they kept on the ship for some time?
We have onboard protocols, the protocols that have been, as I said, designed with New South Wales Health, where they go into isolation.
So they're still on the ship, are they?
Yes, they will be on the ship.
If someone gets severely sick, what's the protocols there if they're on the ship?
If somebody does get severely sick, I can tell you that around the world that has happened extremely rarely because of the protocols, because everybody is vaccinated, because we test very early on, and we do have COVID medication on board. So in some rare circumstances we will disembark a guest, but most of the time we're able to manage on board. The crew that have tested positive, in most cases they're asymptomatic or they have mild symptoms, and after a few days they will come out of isolation.
We know that when the passengers want to disembark and enjoy Sydney, Eden and yesterday, they have to take a rat test first. We had some comments from passengers this morning getting off that nobody had checked those rat tests. What have you got to say on that issue?
Well, two things. Firstly, that is the protocol that was agreed with New South Wales Health. It's a self-administered rat. But secondly, that is happening every day in Australia. Thousands of Australians are testing themselves with rat tests and then reporting them. So it really is the community standard, self-administered and self-reported rat tests.
So that's the way it works here. So it's an honesty system. You test yourself before you get off the ship, but nobody checks, either from your crew or New South Wales Health.
We do ask, and we ask them to attest that they have done it, like anybody.
If someone gives a false attestation to that, what's the consequence?
If we find out they did give a false attestation, we will inform New South Wales Health.
People I've spoken to this afternoon seem to be pretty happy to be returning cruising, walking around, etc., etc. Is this just something that's to be expected and accepted if you're a person who goes on cruises? Over the last 2.5 years, we've learnt a lot about living alongside COVID, and I think for our cruise guests, they understand what it means to get back to normal life whilst COVID is still in the community. We informed everybody before they got on this cruise that we did have some cases in the crew, and majority of them decided they wanted to cruise anyway because they love it. You mentioned that there's been a lot learned over the last 2.5 years. What's been learned from the case of the Ruby Princess specifically?
Well, I think specifically all of that has gone into how we've developed these protocols, which really is, it's about that, but it's more about what else we've learnt. Back in March 2020, we didn't know anything about COVID. Over the last 2.5 years, we've learnt a lot. We've learnt what works. We've learnt that vaccinations work against serious illness. We've learnt that masking works. And those are the protocols. That's the basis of the protocols that we use on Coral Princess.
You've worked so hard on those protocols and setting that up in collaboration with health departments around the country. But tell me how you were feeling when this vessel set off and it was the first to be visiting Sydney. Were there some butterflies? Were there some nerves to put that protocols, those systems you put in place? Were you worried?
No, because we'd been through a number of exercises. We knew this was going to happen. The health authorities knew that we would have a situation where we had, COVID on ships. No one expected that we were going to keep COVID off ship. It was really just about managing it, and we've been ready for this.
Can you tell us a bit about the crew? Were they on the ship before it departed Brisbane?
Yes.
But for how long?
I can't tell you specifically. We have crew
Weeks,
rotating.
Months, days?
It could be all of the above. Crew are constantly rotating on and off the ship.
So they rotate on?
Yes.
So is it possible that one of them rotated on and brought COVID onto the ship?
It's also very possible that a guest, we know that a number of the guests who are positive today actually brought COVID on with them when they boarded in Brisbane.
It's a 5-day cruise. It's hard to get COVID in 5 days.
Okay.
All right.
Thank you very much.
Well done. Perfect.
Thank you.